Acne scars are the permanent marks that remain after a pimple heals. They can be shallow or may go as deep as the next subcutaneous layer of your skin. Though many people believe that it affects only teenagers, so how on earth do you explain your experience as an adult? Have you been searching for a remedy for one or a few ugly scars? If yes, then watch this video till the end as it will bring your search to an end. My name is Ngo and I am passionate about helping you look your best, no matter your age. Have you hit the subscription button? Go ahead and also turn the notification bell on. This way you won't miss a thing anytime our videos are dropped. This video is for moms and teenagers who find themselves struggling with harsh chemicals in order to banish ugly scars for good. You will learn why scar removal is important, suggestions to remove these scars, and a free guide for maintaining a scar-free skin that you can download from this video's description. Somewhere down, what is acne? The English dictionary describes it as a skin condition characterized by red pimples on your skin, especially on the face, due to inflamed or infected oil glands, and is common among teenagers. It is a common skin condition, and the outbreak can be embarrassing and may damage your self-esteem, but don't let them hold you back from enjoying your life, as there are a number of treatments for scarring. What causes acne? Acne is caused by a change in the production of sebum, the oil that your skin produces to keep itself lubricated, soft, and lovely. When the sebaceous glands that produce oil become clogged, it causes a pimple to be formed under your skin. Woo! This pimple is your body's way of dealing with the blocked oil glands at that moment, and when left alone, may take days or weeks for your body to process and clear itself out completely. Although acne scars are a common problem with both teenagers and adults, they don't have to be permanent, and they are caused by any or a combination of the following. Point number 1, your hormones. 2, genetics. 3, diet. 4, certain types of medication. 5, some harsh cosmetics. Why is it important to remove these scars? While acne itself is not permanent, it can leave serious scars on your skin if you do not treat it quickly, and this may cause embarrassment for you. Cystic acne is an advanced form of acne and hard to find an effective cure for. Hence, early treatment of your skin condition is a must. These scars are the most difficult to remove, and they can make you feel uncomfortable about your appearance, how you feel about yourself, thereby affecting your self-image. To feel comfortable in your own skin, acne scars need to be removed. Types of acne scars. The first step in using chemicals or any type of treatment for acne scars is to assess the scar type, which can be classified as follows. Type number 1, ice pick scars. These are deep, narrow holes with sharp edges that can be seen under the surface. 2, rolling scars. They are gradual dip or depression, wide with rounded edges. 3, boxer scars. These are U-shaped scars with sharp edges. They can be shallow or deep. 4, hypertrophic raised scars found commonly on the chest and back, caused by excess collagen during the healing. 5, dark spots. This is the discoloration left behind by a pimple. It goes away after a few months on their own. Don't forget to get your free guide for maintaining a scar-free skin that you can download from this video's description. 2 ways to remove acne scars are available. Acne scars are common, but they will not disappear by themselves. But the good news is that there are effective treatments available. 1, chemical treatments. Each method of artificial scar treatment has its pros and cons and works best for specific types of scarring, determined by your dermatologists. Available scar removal chemical treatments include the following. A. Oral antibiotics. Antibiotics attack the bacteria present in the cysts to reduce inflammation within the scars. Example, doxycycline, tetracycline, female oral contraceptives. The downside, it may only be taken under supervision by a doctor for up to 5 months. B. Corticosteroid injections. Cysts are injected with steroids by a medical practitioner only. They diminish swelling after a few days, but they have side effects during pregnancy. C. Laser resurfacing. It kills acne-causing bacteria with laser, and this process takes up to an hour, and your skin heals between 2 to 10 days. D. Dermabrasion, done by certified dermatologists only. It is the removal of your skin's top layer using a mesh. Or E. Chemical peel procedure. The top layer of your skin is removed using chemicals. There may be allergic reactions to these chemicals. Number 2 type, you have the natural treatments, home remedies. Hydration is key, as with other issues. As I elaborated in another video, do check it out. Items you can use on your own are A. Vitamin E. B. Rosehip seed oil. C. Good nutrition. D. Rose water and sandalwood combo. E. Oatmeal cleanser, rose water and oatmeal mixture. F. Lotions and gels. G. Lemon juice, turmeric, face packs, baking soda. H. Zinc, 50 milligrams 3 times a day. I. Aloe vera. J. Over-the-counter remedies. Your local pharmacy may offer products containing alpha hydroxy acids, lactic acids, retinoids, and salicylic acids. How do you prevent acne scars from forming in the first place? When it comes to acne, you are the best person in the world to know how your skin reacts to different cosmetics, conditions, and situations. The rule of thumb, number 1, is to remove or avoid anything that causes irritation around your face, your hair, your hairstyles, which may be oily, and leave the oil on your face. Scarves or hearts. 2, avoid touching your face with your hands as much as you can. Your hands are not sterile, so whenever you touch your face, you're transferring dirt and bacteria onto your skin, which blocks your pores and causes infection. This leads to outbreaks. If you're prone to acne outbreaks, wash your face less frequently with warm water and mild soap. Pat your face dry. 4, please do not break pimples. This causes more irritation and spreads the infection to other parts of your skin. 5, minimize the use of cosmetics over the pimple. 6, avoid oil-based products on your hair, as it may trickle down to your face when you sweat. 7, ditch alcohol or oil-based facial cleansers and wash. 8, apply sunscreen over scars. Sun exposure darkens the scars the more. In conclusion, while there are many products and treatments in the market to remove acne scars, they can often be expensive and provide limited results. Some even contain harsh chemicals that damage your skin, creating an avenue for skin cancer later on. Luckily, it is possible to get rid of these ugly marks completely. In the end, it is your choice whether to opt for the natural way or any of the dermatological procedures in your attempt to remove scars. I hope you learned 1 or 2 things from this video. Feel free to watch it again. Choose what works best for your tender face. See you in the next video, and don't forget to like, subscribe, and click the notification bell. Thanks for watching. Cheers.